Good afternoon, everyone. We welcome all for today's National Distance Learning Seminar Series, and today's topic is Ethical Dilemmas in HIV Care Settings. And speaker is Dr. A.S. Valan. He is currently working as India EAS officer in New Delhi. Earlier, he worked as regional coordinator for care support and treatment at NACO and as clinical trainer and chief fellow with ITech India. His expertise include public health program management, epidemiological investigations, surveillance, monitoring and evaluation, epidemiological and operational research and capacity building. He has undergone formal bioethics training with the NIE ICMR postgraduate diploma in bioethics and served as a NACO master trainer, member of State Grievance Redressal Committee and State AIDS Clinical Expert Panel of Tamil Nadu and Kerala states during his tenure as a regional coordinator. Thanks for accepting our invitation on NDLS, and now I request Dr. Valan to take over the session. Thank you.
Thank you, Mr. Sudarshan. Good afternoon, everybody. I am very happy to see you all after 2 months. My earlier session was on non-communicable diseases in HIV care settings. I hope all the ART centers in our country are now screening for early detection of diabetes and hypertension in your ART center, and you are referring to the NCD clinic and like doing better service to our HIV infected individuals, those who are attending our ART clinic. So now let's begin to today's session on bioethics. So you all know the AIDS epidemic became known in 1981, the early 80s. In a short span of time, tremendous amount of knowledge about it has been generated after that. The virus was isolated in 1983. A test was available from 1984. By 85, the routes of transmission were identified, and sexual transmission of virus was recognized. Like initially, it was mainly thought that it infects only the gay men, that is homosexuals and intravenous drug users. So initial reaction to this epidemic was from the society and people were fear, stigma, and discrimination. So even the patients, the people, those who are infected, they felt lot of stigma, self-stigma, because mainly the route of transmission, one of the main reason being the route of transmission was through sexual. So you know very well, like in India, the first case was identified. Can you type where was the first case of HIV identified in India? ART center. I want the session to be interactive because there is no, like Rajashekaran sir has already mentioned, like in this session there is no right or there is nothing wrong. So there are 4 common principles in ethics. So we will be following those 4 common principles in ethics, and we will be having our discussions. You have to contribute, because what is right for me may be wrong for you, but we have to agree to a consensus and do good for the people. So keeping in mind, please contribute for the discussions. Okay, so ART Nilofer has typed Chennai, Nagapatnam has Chennai. Yeah, it was in 1986. You may be knowing Dr. Suniti Solomon, late Dr. Suniti Solomon, who passed away last year. She was very crucial. Like first case was identified by her and her colleagues from CMC Vellore, from Madras Medical College. So India also reacted same, like the global community reacted to this disease. The Indian society also reacted same way to this epidemic. So thanks to the antiretroviral therapy, the HIV/AIDS was earlier known to be a acute death sentence. So most of the people were dying. So after the invent of ART and antiretroviral therapy started in late 86, 87, the ART therapy was started. So after that, it has become a lot of changes were made, and now it has become a chronic manageable disease. So now HIV is no more a death sentence. It's a HIV infection is a chronic manageable disease. People live more years, and also they lead better quality of life compared to the earlier years, much better quality of life. But there are ethical issues, and these ethical issues continues. So what all are the ethical issues you think are encountered in the clinical settings, that is in your ART centers, or in any clinical setting, not limited to the ART centers, maybe other healthcare settings, in the private settings, in the government OPDs, IPs, surgeries, so all the places. What ethical issues you think can happen? Please type in your answers. Confidentiality, yeah, it was highlighted in my first bullet. Stigma, discrimination, very, sir has typed stigma, discrimination, LT2, fine. So what else? Please type in no surgeries. Like some places they defer surgery to HIV positive. So mode of transmission, because it is sexually transmitted, you may have some stigma towards this disease. Financial, so financial is not an ethical issue. Yeah, non-judgmental, very right. Like some people are judgmental. Okay, you are HIV positive means you might have acquired this infection through this mode only. So many are judgmental. Right, you are right. Like thanks for the inputs. So let's see what all are the ethical issues, some of the ethical issues, because you know much better than me, and everyday practice you encounter more ethical issues, and all these case studies were derived from the field experience of the ART program all over the country. So you may encounter ethical issues related to confidentiality, HIV testing and consent, pre-operative testing, somebody has already mentioned about surgeries, accidental occupational exposure, there are issues related to accidental and occupational exposure, HIV and marriage, this is very interesting topic, and in our upcoming slide and upcoming sessions we will be discussing in detail regarding this. Discrimination, HIV research, so lot of the research ethical principles evolved after there were a lot of clinical trials and other research activities going on in HIV positive individuals. So many of the CIOMS guidelines were developed based on the HIV trials and all, because there were a few unethical things were happening. So then the world community, World Health Organization and Council for Medical Research, so all they have formulated after the invent of this disease and after this epidemic. And there are also issues like end of life issues, and even after death some people, like when I was doing my fellowship years, there were issues in some part of the country that HIV positive dead bodies, they were not transported. Thanks to the intervention by the governments, like that was taken care of, but still there were issues now and then arise somewhere, and we have to intervene and do the needful for this. Like so even after the life there may be issues. So what do you understand by what is ethics actually? Ethics is nothing but, like, if you translate bluntly, it will be behavior. So there are few right things, there are few wrong things, and there are few things we don't know whether it is right or wrong. So what is right to you may be right, may be wrong to me. So what is wrong to me may be right to you. So sir is very clear, like in the introduction, Rajasekharan sir has very clearly told, like we have to form a consensus, but your answer may be right or my answer may be right, but ethics is nothing but a behavior. There is an action and how you are behaving to that is why. So we have to form a consensus on this, and we will be discussing. So there are 4 principles of ethics. First principle is autonomy. So autonomy is nothing but respect for persons. Second principle, do good for people. So like whatever your action may be, it should be only for good of that person. So you should not. Then the third principle is do no harm. It's like by your actions, you should not do harm to anybody. And fourth principle is justice, that is nothing but equitable distribution of risk and benefits. Are you following me? Do you need any clarification in 4 principles, or is it self-explanatory? Autonomy is nothing but it is a respect for persons. Beneficence, it's nothing but do good, like do only good for all the people. And beneficence and maleficence, non-maleficence are interrelated. So third principle is non-maleficence, that is do no harm, don't hurt anybody. Fourth is equitable distribution of risks and benefits. Any doubts? Okay, you are following me. So shall we move on to the next slide? Okay. So there are few competing principles also, like beneficence versus non-maleficence, autonomy versus justice, because autonomy is individually, like what is we had already seen, autonomy is nothing but respect for personal respect, and justice is for a group of people. There are also competing principles like individual well-being versus societal well-being, and autonomy of the patient versus professional autonomy of the health worker. So these all are the competing principles. They compete with each other. So we will be seeing all these competing principles with examples as case studies in the upcoming slides. So how did this bioethics, bios is life and ethics is behavior. So how this bioethics evolved? So it is, I have mentioned here only the foreign things, like internationally acclaimed, all the experiments, courts, tribunals. But do you think it is only foreign? No. So initially, during very old days, in the first, second centuries itself, in the texts of Siddha and Ayurveda, Charaka Samhita of Ayurveda prescribed duties of physicians towards their patients and fellow professionals in 10th century BC. So this has been documented between 1st to 2nd century AD. So in India it is nothing new. So mainly in the text, India was already having this ethical principles, but in a proper form, it came after this international tribunals and other things. You may be knowing about the Nazi experiments where people were judged to very severe form of clinical trials and experiments, like human experiments were done by the German military. So following this, they will cut one limb of a person and one hand of a person and see what is happening. They will drown somebody in hot water, put them into the hot water and see what is happening to the body, how the body is reacting. So all this cruel things were happening. So then following which, after end of the Second World War, this Nuremberg Tribunal was constituted. So Nuremberg Tribunal was constituted for different purposes, just to have this unhumane practices by this Nazi physicians. But actually it came up with recommendations to for having a proper ethical and clinical code of conduct, that not to harm anybody. So it came with 10 principles. So there are other things also. There is a Beecher's article, we won't be dealing into detail. In 1956 in New England Journal of Medicine, there was a Tuskegee syphilis study which was done in US towards black Americans, that even though the treatment for syphilis was available, they were not given treatment, and they studied the natural history of the disease for a longer duration in the black Americans, and see like how this disease. And you may be aware, in 1997 Bill Clinton publicly apologized for this act of the American government, like public health service, towards black Americans. So there was a thalidomide tragedy, like people were not aware that thalidomide were given for as a sleep medicine. After that, it also produces fetal, that is in the newborns, and also inborn errors also. So some malformations in the fetus were happening. So then they very lately they came to know this. There was a thalidomide tragedy. Belmonte report also briefs about this. Helsinki Declaration was done for the ethics. There were various other World Medical Associations codes, other guides, like in India we have ICMR's ethical guides and all. So, and in the lower level, wherever the research is happening, we have ethical committees and institutional ethical committees. So it has come a long way since the Nazi experiments. Like it has, we have more ethical guidelines and principles and more bodies to govern the ethics for clinical practice, good clinical practice, and the research practices. So why should we talk on ethics in HIV setting? So we need to talk about legal and ethical issues to protect patient's interest, and then whose interest? Only patient's interest? Please type in. So why do we need to talk about legal and ethical issues in HIV care? Is patient interest important? Do you feel patient interests are important? So if somebody comes and asks like, I have this problem, okay, patient and PCOE MCH has typed like yes. So then second one is doctor's interest. Definitely it is also our interest, those who are healthcare providers, and also it is towards, we need to talk about the legal and ethical issues because it is important for the society also. So societal interest is also very, very important. So regarding confidentiality, the first thing we were discussing, the first ethical issue we will be frequently encountering. So this session will be mainly based on confidentiality issues. So in the upcoming sessions, maybe based on your feedbacks, we may have upcoming sessions to discuss about the other ethical principles, like ethical issues encountered in HIV care setting. So the physicians may be aware, like all doctors may be aware, they should take Hippocratic oath before they, after their completion of medical graduation, and they come to treat the patients. So it very clearly says regarding confidentiality, whatever in connection with my professional service or not in connection with it, I see or hear in the life of men which ought not to be spoken of abroad, I will not divulge, as reckoning that all such should be kept secret. So it mainly speaks about, I have taken only the gist regarding the confidentiality. So there may be exceptional situations that you have to you have to breach the confidentiality. So if court of law is requesting for some information, you have to breach. So if there is a threat to person's life, then you may have to not to follow you have to disclose something. Confidentiality may not be followed. So there may be some adverse reaction, like you may be telling the truth, but that will do an adverse reaction. So in this situation also you may exclude the confidentialities. And when there is a risk to public health, so we have already seen societal interest also plays a major, one of the critical role. So when there is a risk to public health, then you cannot just sit and wait that like I will not do confidentiality. So these all are the exceptional situations. So there may be other exceptional situations I would have missed, but these all are the major exceptional situations we encounter in our day-to-day clinical practice in HIV. So let's go to a case study now. The first case study, Mr. R, a 48-year-old businessman, is detected to be HIV positive. He is married and has 2 children, aged 13 years and 10 years. He requests that this information should not be revealed to anybody. What will you do? Please type in. Mr. R is a 48-year-old businessman. He is detected to be HIV positive and he is married, has 2 children, aged 13 years and 10 years. So what will you do? Please type in. And he is requesting that don't tell this to anyone, including his wife. Okay. So Udaipur is telling that we have counseled him to share with anybody. It's not anybody, like it's mainly asking whether he should share with his spouse and children. So we have counseled him to share with anybody. Very good. You are telling the right, like your point of view is like you have to counsel him to disclose it. Go for partner testing. Will you go directly for partner testing without his consent? Does it not breach the confidentiality here? Okay, so has to reveal. Okay, and peer counseling will be given. Ashok Kumar PO Bihan is telling that peer counseling, very good choice, peer counseling. But before that, what should you attempt? So inform spouse. Can you directly go on? Like the situation may vary. Like it is based on your circumstances, what you are encountering in your clinic. Definitely, I am not here to give the this is the right answer, but this may be a way to disclose, like a way to handle this patient. So that is what I am going to tell you. We should counsel about the way of transmission if their children will be married. Okay, before that, definitely during the ICTC testing itself, you should have told how does this spread and who all are at risk. So whether which all are the mode of transmission. So all these things, advise him. So usually in ART center, Kannur has type, but I slightly vary with Kannur. You don't advise anybody in your ART center. We counsel them. So counseling is nothing but one-to-one interaction where you will be helping him to help himself. So you cannot take decision on behalf of him. Usually it is misunderstood most of the time. Counseling is not advising. It is just helping him. Like you will make his thoughts to provoke, and you will help him to help himself. Like he will take a decision for him. So advice usually that doesn't go well in the HIV setting. So this is my opinion. Sorry, again I may be wrong. So what will you do? You have mentioned with the clients concerned, you will tell to the spouse. Okay, very good. So audio not clear. Okay. So Dr. Jyoti is telling audio is not clear. You can check with Sudarshan. There may be problem from your issue. Testing will remain voluntary. So testing for him is voluntary, but what about his wife? It is also voluntary. But here the point is, he is married and has 2 children. Okay, so do you have to test his wife and children? So in your ART card, like if he is coming to your ART center, in your pre-ART card or ART treatment card, white card, there is a column that spouse details and family history. So what will you do? You have to enter that. Not only for entering, but ethically, like what you as a healthcare provider, it is your obligation that you should try to help him. So first, what you can tell is, initially you can just guide him, like how the disease spread, like why they are at threat, why it is important. So all the positives and negatives of disclosing. So you can tell him, like if you bring your wife, then we can test her. So if she is not infected, then we can plan our future treatment plan like this. If your children are infected or not, we have to find out. And if we are starting early treatment for them, then their longevity and quality of life, everything will be better. So all these options has to be provided. You have to encourage him to disclose to his wife, and if he is finding it difficult, you can support him with the counselor, and then you can plan like whatever steps you have to do. So we will be seeing in this upcoming stage. So in this situation, what you will do, you will try to divulge the information through him. So that is what you will do. And we explain the mode of transmission, and it is important to test spouse and family. So are you clear regarding this case? So what you will do? Because in marriage and they are having sexual contact, he and his wife are having sexual contact. If she is not infected, still you can prevent infection, right? So by testing and probably counseling him, and also repeated counseling to her also. So you can help their family. Okay, safer sex, all these things. Definitely you will tell about safer sex. If she is infected or not infected, in both the case, safer sex has to be practiced. So you will infect her. We can counsel his family members. Okay, first you have to counsel him, and then you can tell him to disclose, and followed by, if he is finding it difficult, then you can have a professional counselor with you. Even after counseling, if he is not willing to disclose to his wife. Very good question. And let me answer in the upcoming case studies for this question. So case study 2, Mr. M, a truck driver, is admitted with prolonged fever and is diagnosed as HIV positive. His hospital bills are paid by his owner. The patient says that his status should not be revealed to any person other than his wife. Is he right in telling that? We don't know, but still you can give the option. Counsel him, yes. So his owner meets you and asks for a complete diagnosis. What will you do now? So M is a truck driver admitted with prolonged fever and is diagnosed as HIV positive, and his hospital bills are paid by his owner. So what will you do now? Because the owner is telling, like I want to know what all are the tests you have done and what is the complete diagnosis, because I am paying the bill. What will you do? This is a very tricky situation. Should not reveal. The patient is telling that his status is not to be revealed. So you will follow the patient or the owner? No, we can or no, I don't understand. Vihan, TNP, Ashok Kumar, no, we can. Or I don't understand. You are telling no, we can or cannot. Not disclose. Okay. So it is not to disclose, because he has requested you have to maintain the confidentiality, not to disclose. But there may be again a tricky situation. Let's see, let's come back to this case study after discussing the third case study. So here we are at present we are limiting to the first question. The patient says his status should not be revealed to any person, so we are not going to reveal other than anybody other than his wife. So we are not revealing to the owner as of now. Okay, let's see the third case study and we can discuss the both the case studies together because they are interrelated. Mr. X is working in a public sector industry. The factory has an understanding with the hospital that they will clear the bills only if a discharge summary is given with all the lab tests. Mr. X tests positive and requests that his results need not be informed to the factory. What will you do? Please type in. To respect the patient's autonomy, we try not to disclose the diagnosis. You are right. We can give diagnosis without his HIV status. Another point, you are right. So there are no wrong answers here. Please feel free to type in. Not to inform factory, should not reveal, please type in. I'm waiting. We'll wait for another 20 seconds. So we'll try to disclose the HIV status to whom? Nipan Uti Vihan, please be clear when you are conveying something. Counsel the owner and disclose. Why to counsel the owner? Please explain. So I'm not telling you are wrong. I understand you have to counsel the patient, but why to counsel the owner that not to disclose? That was your intention. So as per the guidelines, they have to maintain the confidentiality. Okay. Okay, so let's freeze here. All your answers are right. Do not inform the status. If inform, he will get discrimination issues. So that is true. Definitely he may get discrimination issues. So here, so we conclude this, like we are not concluding, but my point of view is like you will be highlighting the problem of third party players. So unless there is a contract between the hospital and all concerned, patient and third party, confidentiality has to be maintained. In the first case, I don't think there will be a contract between the hospital and the truck driver, right? So, but if there is a contract, maybe in the second case where a public sector industry, there is a contract between the public sector industry and this thing, here it is little bit tricky. So otherwise, when there is no contract, you need not disclose. Okay, the hospital is not a party to the contract between the first thing, the KCM and his employer. In case of second case, Mr. X, then you have to be very careful. The hospital may have an obligation for the hospital to provide information. So you have to be very careful. There are again, I am telling you, this is one point of view, but the same case scenario may also come to you. So you have to be very, very careful. Okay. So another one suggestion from Udaipur, very good suggestion. One more thing, except HIV report all lab tests. But who will pay for the test? Then you have to tell, you may tell to the patient that I am submitting all the reports. So for his HIV test, the patient may have to pay for himself. Shall we move on to the next slide? Are you clear in this, or you want more discussion regarding this? If the patient cannot pay the bill by himself, and we have only option paying the bill from inform the higher authorities of factories, because they are requesting. So you have a contract that if you have a contract, you have to follow the contract. If you don't have a contract, no problem. You can do whatever you want within your powers, right? So I would like to have inputs from Rajashekharan sir. Refer to ICTC. Sir is typing refer to ICTC. I didn't get you, sir. Definitely refer to ICTC, where it will be very good suggestion. I understood. So sir is telling refer this patient to ICTC. That is another one way. you are referring this patient to a government ICTC center, so where all tests are free, and he did not have to disclose his result to anybody because he is doing it in a different place. So, but if it is another hospital where there is a contract, then they may have to provide the information. Thank you, sir. No necessary for paying. Yes, sir. Thank you, sir. Let's move on to the next slide. So, confidentiality and doctor-patient relationship. Hippocratic oath lays a lot of stress on confidentiality. We had seen the phrase regarding confidentiality. The Medical Council of India Code of Medical Ethics also insists on the same lines. So ethical principle underlie confidentiality, principles of no harm, that is non-maleficence, autonomy and patient rights. So you will be repeatedly hearing these four principles, majorly three principles. Justice is missing here. So, so all these things you will be repeatedly hearing, because mainly in your clinical practice you have to do betterment for the patient interest. Second thing is, you should not do any harm. You should do best for the patient. You should respect that patient's autonomy, and you should have a equitable justice for the patient you are treating. So HIV infection and confidentiality, since HIV infected patients are stigmatized and discriminated by the society, confidentiality has to be protected. Do you all agree? Yes. So Indian courts taken cognizance of this aspect of HIV infection, and in the landmark judgment, the Bombay High Court ordered masking of the identity of parties involved in HIV disputes, MX versus XY. So even they didn't mention the name because it may be divulged. And in the 1997 Bombay High Court judgment. So medical profession has an obligation to protect HIV infected individual. So are you clear in this? So even the court, they have masked the identity of the patient, and they have asked to mask. So they didn't reveal like what is the name of the patient in their judgment. So now you feel how ethical issues, like ethical things and confidentiality, are more important in our country. Even the legal system and jurisdiction, they insist on masking the identity. So are you clear? Okay, let's move on. So healthcare, nurse, ward staff, counselor and laboratory staff. So this is mainly I'm telling about the ART setting. And also, for example, a surgeon or a specialist whom you are referring, you will be disclosing the results, because that will guide him in diagnosing and properly managing this patient. So what do we call this? So the health status of HIV status of a patient will be known to a treating physician, nurse, ward staff, counselor and laboratory staff, and also other specialists. What do we call? Is this confidentiality? Still, do you feel confidentiality is still maintained here? Because by like just one person cannot decide, right? It's a teamwork. You in an ART center, patients are coming, and there is a data manager, there is an administrative staff, there is a care coordinator. So many people are there. So what do we call? Is this still confidentiality maintained? Ring of confidentiality. Do you mean sharing of okay, very good. Thiruvarur has responded. It's a shared confidentiality, and shared confidentiality is permitted by law, and also our NACO guidelines also permits shared confidentiality. This is what is called shared confidentiality, but you have to maintain. POE Sion Hospital is saying professional secrecy has to be maintained, definitely. So this should be this information has to be circulated only with the professionals, those who are directly involved with dealing with this particular patient. And it should not be discussed with any other person who is not directly involved in the treatment or management of this patient. Are you clear? Okay. So being a leader, a physician should train staff to maintain confidentiality. So the major aim of this session was to make you understand like what is the responsibility of a ART medical officer sitting in an ART center. It is not only just prescribing treatment, but you should also train your staff how to maintain confidentiality, how to properly behave with the patient. So all these aspects of you have been trained. So you have your NACO medical officer training, and in those training, Dr. Rajashekharan sir has emphasized very greatly not only on clinical treatment of the patient, but also how to deal, how to make the patient cope up with stress, how to deal the ethical and legal issues which are arising. So he has made a very good slides. Like most of the contents from my slides also taken from the NACO medical officer training module only. But you should disseminate this information to your colleagues and also those who are working under you. So that is what our intention is for conducting this session. An unauthorized person shouldn't have access to medical records. So this is very, very important. Like we had seen, like in some of the places, so we even though we insist that all the medical records, white cards, everything has to be kept in a locked cabinet, like after going you have to lock it properly. So it may be, but some places it is not followed. So not in many places, but some of the places they do not follow. So now you feel the importance. Not like this, even the legal system is very strong regarding this. If there is a breach in confidentiality, somebody takes a white card from your center and disclose the result to somebody else out, and you will be in trouble. It is also your AIT center's responsibility to keep your white cards properly stored in your center, not having, like, not to be accessed by any unauthorized person coming from outside. So that's why, like during my days with the regional coordinator, I used to resist some people taking other people's white card Xerox copies. Like we practically prohibited all these things, because this is the patient, like confidentiality is lost if somebody is allowed to take the copies or something. We were like, you may also encounter, like some one or other reason somebody asked this, you should not give unless it is requested by the court of law or insurance companies. We will be seeing that. So you should not give access to any other person, unauthorized person, to access the treatment thing. So we have seen about the shared confidentiality. So sometimes confidentiality has to be broken when a disease is notified. Do you agree? Yes. So is HIV/AIDS a notifiable disease in India? Yes. Pondicherry says yes. Please, Pondicherry can give me the notification number where HIV is notifiable. I may not know, maybe in some places, but as for a country, HIV is not a notifiable disease. In India, HIV is, like, as far as Indian government is concerned, it is not a notifiable, like you have to divulge the information, but usually as per law it is not a notifiable disease. Are you clear? No. So Pondicherry, you may have some provision, I am not sure, you may have, but as a whole of the country we don't have. Being health a state subject, Pondicherry may or may not have, I don't know, but if you have, you can please share it with ITEC and NACO so that we can have a look, like what was the public health order declaring HIV a notifiable disease. Is TB a notifiable disease? No. If a person with HIV positive going to marry, so we will be having a session on HIV and marriage. It has to be discussed in detail. So we are having some case studies in this slide in the current session also, but later we can have a proper discussion on HIV and marriage. It is a vast subject, right? So, okay, is tuberculosis a notifiable? Yes, TB is a notifiable disease. So, as per the Government of India order dated 7th May 2012, TB notification is mandatory. Anybody who treats TB patient in private or public sector, who diagnoses and treats TB patient, it has to be notified to the public health authority, either corporation people or district level TB officer or director public health in some places, or the state authorities. So they have to notify all the TB cases. But HIV, as of now, there is no law, and there is no such notification orders from the health ministry, as per my knowledge. If please correct me with evidence if I am wrong. Some of the states may have still. So let's go to the fourth case study. Mr. KR is HIV reactive. He has not told his wife of his HIV status. He says that he is practicing safe sex with her from the time of diagnosis. What will you do? So it is similar to the case study 1. So KR is HIV reactive, has not told his wife of his HIV status. He says he is practicing. Somebody answered safe sex has to be practiced. So now here is the case. What are you going to do? Please type in. Counsel him to disclose. Very good. I think I am making some impact, or maybe you know beforehand. I don't know. So counsel the patient to disclose. If he is not counseling, repeatedly counsel him. And because her testing is also important, right? She may be positive, so then you have to intervene. You have to treat her with antiretroviral therapy based on her CD4 levels as per the NACO guidelines. So okay, people are counseling him. Spouse testing is important. The same time, safe sex and white testing. Very good. PCOE MCH is telling. You have to counsel him, disclose him, but same time HIV, safe sex and has to be practiced. So the answer may be using the condom cannot be an excuse from disclosing his HIV status to his wife. So because he is using condom, that doesn't mean that he should not disclose. Condoms are not 100% safe. Sometimes there may be condom tear or due to some friction or something may happen, and there is still a chance of transmitting, and it is not 100% safe always, right? So you have to, first case study, you have to disclose the HIV status to his spouse or sexual partner. Okay. Partner notification. Uninfected partners have an ethical and legal right to be protected against acquiring the infection. Hence, partner notification is justified. About 10% of the patient inform their partners. So this is based on a cross-sectional analysis study done in a HIV care setting. 30 to 40% of take time, and nearly 50% of the patient will never bring their partners. So this was done very long back, around 2010. So now the scenario may be different because our counselors are doing a wonderful job. By ICTC and ART counselors, they are doing a wonderful job in communicating the information and properly counseling the patients, those who are coming to ART centers, and also HIV infected and even non-infected, those who come for ICTC testing. So now this may have a different results, but I didn't find any recent studies. So what to do with the 50%? Definitely you have to find a way to disclose the results, right? The health personnel have a moral obligation to notify partner. The patient must be encouraged to disclose status to the spouses. If you fail in disclosing the uninfected partner, what will happen? If you are not disclosing things to the uninfected partner, what will happen? Is it punishable? Wife may get infection. Okay, legal. What all are the legal aspect involved in this? Not disclosing to an infected partner. So also there are legal issues with the person who is having infection and not disclosing and disclosing to the uninfected partner, and also obligation from the healthcare provider side. Counseling by peer will help. Definitely, peer counseling will is going to help definitely. So let's see what are the legal points here. So can a patient deliberately infecting a person be punished? Yes, he can be punished. Indian Penal Code 270 says, malignant act likely to spread infection of disease dangerous to life. Whoever malignantly does any act which is and which he knows or has reason to believe to be likely to spread the infection of any disease dangerous to life, that includes HIV, shall be punished with imprisonment or either description for a term which may extend to 2 years, or with fine, or with both. So once again I will read: malignant act likely to spread infection of disease dangerous to life. Whoever malignantly, that is knowingly he is spreading the disease, when he know the diagnosis of disease what he is having, or he is believing he may have HIV infection which is transmissible, then knowingly if he is not disclosing, then he may be punished with imprisonment, that is he may be sent to jail, or with fine, or with both. So please, this IPC section 270. So what does IPC 269 says? It is regarding the healthcare provider, doctor. a negligent act likely to spread infection of disease dangerous to life. Whoever unlawfully or negligently does not act which he knows or has reason to believe to be likely to spread the infection of any disease dangerous to life shall be punished with imprisonment of either description for a term which may extend to 6 months or with fine or with both. So if a doctor or a healthcare provider, he negligently not disclosing that this patient is potentially having a life-threatening disease which is transmissible from one person to another, and if he is not disclosing, he may also held responsible and he may be punished. So Ashok Kumar has typed Supreme Court judgment Mr. XV Hospital Z section 296, which had held that person's right to get married was suspended during Ashok Kumar, you are a little bit hurrying up. As I have already told you, we have case studies regarding marriage and we will be discussing. Thank you for bringing this. Like he has brought in a very valid point and very important landmark judgment from the Supreme Court. Thank you, Ashok Kumar. But anyway, like this is a very detailed subject, like marriage and HIV has to be discussed in detail. But I have few case studies. We will just put this question in the parking lot and we will discuss later. Okay, I think this fits for you. So health personnel can be held liable for not informing HIV status to uninfected spouse of the patient. So are you clear? So health personnel can be held liable for not informing HIV status to uninfected spouse of a patient. Okay, so let's go to the case study 6. Mr. D is HIV positive. He is unmarried. His parents have fixed his marriage in the village and his friends inform you a day before the marriage. What will you do now? So please answer. Mr. D is HIV positive. He is unmarried. His parents have fixed his marriage in the village and his friends inform you a day before the marriage that he is going to get married. So ART Teni has asked a very good question. Will doctors be held liable if a patient commits suicide after we disclosing the spouse? If a patient is committing suicide, here you have to have one more very important. Like there is also a part, like you could have contributed, maybe not all the time. You might not have diagnosed as he is having some depression or something that he may end up his life. So you have to counsel him. As a doctor, you have to counsel him, and also you have a professional counselor who is sitting in your ART center. You have to counsel him. So that may need repeated counseling sessions. So first thing, but not in all the scenarios you can prevent all the deaths, right? Like things may go beyond your hands, but there is also always a chance that you can intervene and you can prevent that suicide. But legally, you are protected. If you had attended a ethics session when you are undergoing medical officer training or a counselor training or a staff nurse training or MNE training, also we had this session. And in Tamil Nadu, if you remember, it was very clearly told, like you have the legal protection but definitely you have to intervene through your counseling session. You have to identify the suicidal thoughts very early. You have to detect it very early. But still, like I'm not telling you directly go and tell the spouse or a sexual partner, but you have to make an attempt through counsel him to disclose by himself. That is the best way, right? I think I am clear, Teni ART. So right to know the status. Okay, many people have typed in the parents have to cancel the marriage without disclosing. Yeah, that is an option. Very good. Stop the marriage and give counsel the parents. Like why to parents? First counsel the person. Why he might not have disclosed his status to his parents, right? So but he knows his status. So you have to think about that. Guardian counseling followed by partner counseling. So you can counsel first the person. Then if you can by counseling the person, you may abstract the information whether he has disclosed to his parents or not. If he has disclosed, then you can have a family counseling. Inform legal aid, very good thing in some states like Tamil Nadu and Andhra and even in Bombay. I don't know about other states because I have visited. I have seen the legal aid clinics in support of ART program. So they have legal aid, so they can definitely help. CSC Vihan people can help. So you can get support from all these people, and you have to intervene in this scenario. There is always a scope that you can, but again, there is a question mark. If he has disclosed and still the girl want to marry, then what to do? So that is again an ethical dilemma. Would be right to know. So the would be has right to know. Very good. Arielu Riati, she has a person who is uninfected has right to know the status of its partner. Okay. NACO guidelines. Physician has to inform the HIV status to sexual partner of HIV infected person. And how should we go about it? We have discussed. The patient tells the partner and brings for counseling. The patient asks the doctor to tell to the spouse, and the patient does not bring the spouse. So these all are the three situations. So usually you don't see all the patients bringing the partner for counseling. So sometimes you may have the patient telling you, doctor, can you tell, because I am afraid, I don't know, this is a big disclosure, so it will be very difficult for me. So okay. So Ashok Kumar counseling for, okay. Prospective spouse. So thank you, sir. So prospective spouse also to be informed. So there is a case in Supreme Court of India, there was a case that a person who donated blood, then what happened? His blood was left to some other place. His blood was tested, and the blood was mainly for his uncle, his spouse uncle, like would-be's uncle. He had a fiancée. Fiancee's uncle has to be transfused. So their marriage was supposed to happen next month. So then the blood was tested positive. So then the hospital disclosed the results of this test to the fiancee's family, and the marriage was called off. So then again the case went to court. The doctor has, the person who has donated the blood and who was infected, he has told that they cannot disclose my result to some other person, to my fiancée. So there are n number of other cases also. The fiancée has right to know the HIV status. In High Court of Andhra also there were cases regarding this. So probable the fiancée also has right to know the status. Like if they are demanding HIV test, then before marriage you have to produce the result if they demand. Okay, let's go to the case study 7. Mr. KR has filed a suit in the family court asking for legal separation from her husband, Mr. KR, claiming that she came to know her husband's positive HIV status in the ART center during the couple counseling. The court seeks HIV result from institution for verification. What should institution do? Can HIV be legally admissible reason for divorce? Please type in. Ashok Kumar has already answered this. Yes. So HIV can legally admissible. So there was a case in Supreme Court judgment, Mr. XV Hospital versus Hospital Z in 1998, which had held that the person right to get married was suspended during the period when a person is HIV positive, and if a person living with HIV were to marry, he or she may be guilty of an offense under the Indian Penal Code. Is it clear now? So we have a landmark judgment. Thanks Ashok from Vihan. Okay, let's move on. So HIV and divorce, ethical stand, uninfected person has right not to get infected. Or do you agree? So any uninfected person has right not to get infected, right? So the infected person has right to not to get discriminated and stigmatized. All uninfected has right not to get infected. And there is a legal stand we had seen. Infected person has no right to marry. So this is we'll be discussing this in detail, like why if they have infection and they are hiding the fact and they are planning to marry. If they hide the fact and planning to marry, they have no right to marry. HIV can be a valid reason for divorce, and right to confidentiality is lost in this. So the judgment I had read out earlier very clearly says this. So let's go to the case study 8. Mr. SR has been married for past 9 months. She has problem adjusting with her in-laws. She became pregnant, and during the antenatal checkup she is found to be HIV positive. Mr. SR also found to be positive. Both husband and wife are positive. They have decided to keep it a secret. So mother-in-law wants to know about the tablets Mrs. SR is taking. What tablet she may be taking? Please tell. SR has been married past 9 months. She adjusting with in-laws. She becomes pregnant and finds that in antenatal checkup she is HIV positive. So think she is in an ICTC center. Okay, people are typing in. Please, those who are not aware. So India has already adopted option B plus 2 years back. Okay, all the states. Initially it was in Karnataka, Andhra, Tamil Nadu, then Maharashtra. Now it is in all the states since past 2 years. You have to start once you find out any ANC case HIV positive. You have to immediately start after doing the baseline workup. For any probable nephropathy or some other kidney disease related disorders or any other possible side effects with the TLE, you have to immediately start. Even you can do the CD4 later, but you have to start after doing the initial clinical examination and initial baseline workup. Okay, so she may be taking TLE, and she also want to know, like her mother-in-law wants to know whether daughter-in-law has a serious disease, as she had some skin rashes 3 months after the marriage. So will you disclose it to mother-in-law in this scenario? Do you have to disclose? Should not disclose to mother-in-law. Okay, very good. So you won't be disclosing because husband knows, husband has been tested. Here again there is no legal or ethical issues between husband and wife. So here the mother-in-law need not. But here you have to keep in mind that sometimes in some families, like if you are counseling, you might have encountered the family members are very supportive. Mother-in-law or mother of the girl or boy may be very supportive, and they will help them in postnatal care and proper feeding, like breastfeeding practices, because if it is a first child, the lady may not be knowing how to do proper breastfeeding and all. So based on the situation, this is not the unique, like it is the only answer that mother-in-law should not be disclosed. But if the husband and wife, they are requesting you disclose it, if they are seeking your help to disclose it, based on the situation, it may vary. As I had told you earlier, like this is not right or wrong thing. So based on the situation, you have to act. Are you clear in this? But it is not necessary, or legally it is not required to disclose it to other person other than the partners, right? Okay, so with the acceptance of the couple, very right. If the pregnant woman is HIV2, okay, sir has asked, okay, Udaipur immediately has typed lopinavir, ritonavir, and the child during delivery, immediately you have to give zerovidine syrup, not nevirapine, because HIV2, the NNRTAs will not be acting. Okay, so you have to give nevirapine, zerovidine syrup if it is a HIV2. Thank you, sir. Thank you for bringing in this. So let's go to the next case study. Mr. AS has comes barging into the OPD and starts fighting with the medical officer. He is angry that the diagnosis of HIV has been written in his discharge summary. He threatens to go to the consumer court. Is he justified in his anger? He is angry that diagnosis has been written in his discharge summary. How can you write the diagnosis? He is justified. Nagapatnam says yes. So you are telling that you should not write diagnosis of HIV in the discharge summary. No audio. Please type into Sudarshan so that he will help you. Nagapatnam. Okay. No, he cannot write HIV positive. So what should you write? What is the Supreme Court guideline regarding this? You can write. No, it is not immunological failure. Immunological failure is a different terminology. You will be monitoring the patient on CD4 counts every 6 monthly, and then if he fails, then you will name him as immunological failure. Okay, there are 3 criteria. Like you may be referring, like you will be referring these patients to the SAM. Immunosuppressed or immunocompromised state, immunodeficiency. Okay, so immunocompromised state, okay, you are right. So you can write immunocompromised state, but still you have to write if you have done the HIV testing, you have to write whether HIV positive or negative, HIV reactive or not. Will you write this? Yes, because discharge summary is given to whom? So again, please, this is my point of view. Discharge summary you will give to whom? To the particular patients, right? You are not going to give it to anybody else. So just call the patient, give the discharge summary. It is for him, And if he is showing the discharge summary to any other doctor, again you are not violating the principles of confidentiality. There is no breach because there is something called shared confidentiality. If he comes for a follow-up, he will be seeing another specialist who has to know what is his disease. So here I don't think, my point is, I don't think there is a breach in confidentiality in writing a diagnosis of HIV in his discharge summary. Okay, but you should not make it public. That's all. Okay. Nahi likhna chahiye. Okay, very good. KSCH is writing nahi likhna chahiye. It is your point. You can write immunocompromised state. Immunocompromised. Okay, very good. Oh, very rightly you are telling, and we have mainly regarding the disputes of insurance claims. We have this like the Supreme Court of India, Honorable Court of India has given a directive to write immunocompromised state. Okay, he is not justified in his anger, and he can go to consumer court, and you are legally protected in this because it is your duty. And okay, preamble is telling it is not biohazard. Okay, so let's come to the last case study. Mrs. RP comes to you with LIC claim form of her husband. He died of cryptococcal meningitis. The insured amount is 2 lakhs. She requests you not to write the diagnosis of his HIV status in the LIC form. What will you do? It is contradictory to, we have competing principles, right, in ethics. It's contradictory to the earlier case study. So somebody is telling not to write. So what will you do now? Death is not due to HIV. So death is due to what? Due to cryptococcal meningitis. Right? Again, definitely you can write immunocompromised, you can write, you have to write cryptococcal meningitis, but they are asking for HIV status. Please be clear. They are asking for HIV status. Everything what you have told is right. It is, you have to write immunocompromised state. Death is not directly due to HIV, it is due to cryptococcal meningitis or some other complication. He might have died, like we don't know. So we have to see the death records, like death declaration. But in LIC form, will you give status? Only Nagapattanam, I didn't follow you. Only I didn't get you. Not to give HIV status. Okay, you have to. So certain things are legally we are entitled to give. If it is a LIC form, it is a very clear-cut guideline that you have to give the HIV status in the LIC form. If you are hiding the fact, again you can be legally you are responsible under the Indian Insurance Act. Okay. So license from form is for patient. No, it is insurance form. It's not license. LIC is Life Insurance Corporation. Sorry, I should not have mentioned, like taking an ethics session. It was mistake from my part. It is insurance form, LIC form. Sorry. The diagnosis entered in the case records to be revealed. Thank you, sir. So whatever diagnosis you have entered in the case record has to be maintained, and his HIV status, if they are asking, you have to provide. You are entitled to provide this information to the insurance people. So the key points we have discussed: the HIV infection, moral, ethics and legal issues involved. 4 principles. What are the 4 principles? Please type in. First principle. What is respect of to persons? What is the exact wording for respect to persons? No, Tenkasi is writing no. Why? I don't get you. So you have to give in insurance forms. Autonomy, very good. Arielur has said autonomy, do good, that is beneficence. What is do not harm, that is non-maleficence. And justice, 4th principle is justice, that is equitable distribution of risks and benefits. Respecting consent and confidentiality, we have seen case studies. And what is shared confidentiality? We had a few things like how a doctor in an ART center, how he should function as a team leader, and like not to have the treatment details and HIV status accessible to other people. Only shared confidentiality is between
the patients, persons, those who are directly involved with the treatment of the client. And we have seen the competing principles of ethics. So I believe this. I acknowledge Dr. Nandini Kumar, former Deputy Director General, Senior Grade, now with Manipal University as Adjunct Professor, Kasturiba Medical College. So she was my teacher during my bioethics course, and she was the one who trained me in my PG diploma in bioethics. Rivari sir, my previous supervisor when I was a regional coordinator, and who has reviewed the slides which I had sent. Dr. Rajashekaran, always my teacher, and every day, sir, we learn from you. Whatever HIV knowledge I have, most of the knowledge has been given from you. Dr. Anwar Pervez, medical advisor, iTech India, for giving me this opportunity for doing this session. And the online PG diploma program, and one of my colleagues is also attending, Dr. Swarna. Thank you, Swarna, for participating. Thank you for participating in this session. And this session, like if you are interested in listening ethics session related to HIV, and if you want to have more sessions on this, please write to iTech. And there are a lot of other issues like values, right, compliance, morals. And as I said, like when you talk about ethics, you should understand there is nothing called right and wrong. What is right may be wrong to me, what is wrong may be right to you, but you should have a proper behavior. You have to find a midway, and you have to do follow the four principles, and you have to do justice for the thing, the action what you are doing. So if you are interested to hear more, please write to iTech and NACO. So I am ready to contribute for more things. Thank you, Arielu, Riyati, Dindikal. I too miss you all. Thank you so much. So if you have any other questions, we don't have much time, please type in. I'll get in touch with you. I can get it from Mr. Sudarshan, and I can respond. Maybe if I am not able to answer, I can ask my mentors, and I can help you out. Thank you, sir.
Thank you so much for such a valuable session, sir. I think the participants, everyone have enjoyed, and then thank you all the participants for the patient and kind listening. So I request all the participants to kindly enter the e-poll which is displayed on the screen. Again, I am requesting all the participants to kindly enter the e-poll which is displayed on the screen. Your answers will be more useful for us to improve our quality of the NDLS. So please kindly enter your answers in the e-poll. Thank you.
Okay,